Hello, I'm Dr. Kevin Reji, consultant neurologist in Lourdes Hospital, Kochi. So I'll be talking on what is epilepsy and seizure and how do I know if I have epilepsy. So as you all know, epilepsy is a neurological disorder which affects the brain. It is a tendency to have repeated seizures. This tendency can be long-term, but the seizures can be controlled. So a person can have epilepsy, but they may not have active seizures. So what exactly these seizures are? So as you know, our brain is a control center for the body. It has millions of cells called neurons. Neurons fire chemical messages to make our bodies work properly. Sometimes neurons may misfire and the chemical message is mixed up. And this can cause a seizure. The seizures are brief and sudden disruptions to the electrical activity in the brain. And seizures start in a part of the brain or happen in both sides of the brain at once. And what type of seizure happens depends on where in the brain the misfire happens. And talking about how one knows if one has epilepsy. So when you first had a seizure, you may have been taken to hospital. If it was your only seizure, you may not have got a diagnosis of epilepsy then. This is because many people will have a single seizure and most never have another, while some will have two or more seizures and may be diagnosed with epilepsy there. Sometimes a person can be treated with medication after the first seizure if the tests such as EEG, CT scan, or MRI suggest epilepsy, and the doctor feels there is a risk that they'll have more seizures. So your medical history also plays an important role in the diagnosis of epilepsy. So many people have normal tests and scans, but epilepsy can still be diagnosed. So in about 50% of cases, the cause of epilepsy is not known. So remember, anyone can develop epilepsy at any age. To help in accurate diagnosis, witness is important. And try to get as much information as possible from anyone who saw the seizure. And videos can be extremely helpful in diagnosis. Thank you.